Welcome to Healthy Doc Top 10, where we bring you the top 10 health tips and guides. Ever wondered how many people around you might be silently suffering from hemorrhoids? It's a question that might not often cross your mind, but the reality might surprise you. Hemorrhoids, also known as piles, are a common yet often unspoken health issue that affects millions of people around the globe. In fact, according to the American Society of Colon and Rectal Surgeons, nearly half the population will have experienced symptoms of hemorrhoids by the age of 50. That's a substantial number of individuals dealing with the discomfort and inconvenience of this condition on a daily basis. But what exactly are hemorrhoids? In simple terms, they are swollen veins in the lower part, the rectum and anus, similar to varicose veins. They can be internal, that is, inside the rectum, or external, under the skin around the anus. So, how would you know if you or someone you know is battling with hemorrhoids? Well, the symptoms can vary. Common signs include discomfort, itching, or pain around the anal area, especially when or during bowel movements. One might also notice bright red blood on toilet paper or in the toilet bowl after a bowel movement. In some cases, a hard, painful lump may form around the anus. These symptoms can significantly impact the quality of life, making routine activities, like sitting or going to the bathroom, a challenge. However, it's important to note that not everyone with hemorrhoids experiences these symptoms. Some people may not even realize they have them until they see a doctor for a routine checkup or for another health issue. This is why it's essential to have regular health checkups and to seek medical advice if you notice any changes in your body. So it's clear that hemorrhoids are more widespread than we may have initially thought. But what can we do about it? Before we dive into the solutions, it's crucial to understand what hemorrhoids are. Hemorrhoids, often known as piles, are swollen veins in the lowest part of your rectum and anus. Similar to varicose veins, they can be a result of increased pressure in the lower rectum. This pressure can be the outcome of various factors like straining during bowel movements, sitting for long periods on the toilet, or even something as natural as pregnancy. Now, why do they occur? Well, as we age, the tissue that supports the veins in your rectum and anus can weaken and stretch. When that happens, hemorrhoids can form. They're actually quite common, with about 3 out of 4 adults experiencing them at some point. Let's delve a bit deeper into the different types of hemorrhoids. First, we have internal hemorrhoids. These exist inside the rectum. You might not even know you have them since they're often painless. However, straining or irritation can cause them to bleed. Next, we have external hemorrhoids. These are under the skin around your anus. When irritated, they can itch or bleed. Sometimes, blood may pool in an external hemorrhoid, forming a clot. This condition is known as a thrombosed hemorrhoid, and it can cause severe pain, swelling, or a hard lump near your anus. Finally, there's something called prolapsed hemorrhoids. These are internal hemorrhoids that have stretched down until they bulge outside your anus. They can be felt as moist, pink pads of skin that are pinker than the surrounding area. Prolapsed hemorrhoids might hurt because the anus is dense with pain-sensing nerves. In terms of their severity, hemorrhoids can vary from being a minor inconvenience to a major source of discomfort. But it's important to remember that they're not a cause for embarrassment. They're a common health issue that many people experience. Now that we have a better understanding of hemorrhoids, let's move on to the most important part: how to eliminate them. The journey to eliminating hemorrhoids often starts with what's on your plate. If you've ever heard the saying, "You are what you eat," then you understand the profound impact diet can have on our body and overall health. In the case of hemorrhoids, it's no different. A fiber-rich diet is often the first line of defense in preventing and reducing hemorrhoids. Dietary fiber, found in foods like whole grains, fruits, and vegetables, aids in softening the stool. This makes bowel movements easier and reduces the pressure on the hemorrhoidal veins. In turn, this lowers the risk of developing hemorrhoids and can alleviate symptoms in those who already have them. But where do you find these magical fiber-rich foods? Think of whole wheat bread, brown rice, and oats. Think of fruits like apples, pears, and raspberries. Picture a colorful array of vegetables such as carrots, broccoli, and Brussels sprouts. And don't forget about legumes like lentils, chickpeas, and black beans. Incorporating these foods into your daily meals can significantly improve your digestive health and help keep hemorrhoids at bay. However, there's more to diet modification than just upping your fiber intake. Staying well hydrated is equally important. Drinking plenty of water each day helps soften the stool and promotes healthy digestion. Aim for at least 8 glasses a day. And while we're on the subject of fluids, let's not forget that limiting caffeinated and alcoholic beverages can also be beneficial. These can lead to dehydration, which can exacerbate hemorrhoids. Lastly, while it may be tempting to rely on laxatives when dealing with constipation, they can often do more harm than good. Overuse of laxatives can lead to dependency and can further irritate hemorrhoids. Instead, focus on natural ways to promote regular bowel movements, like exercise and a balanced diet. Remember, your diet can either be your greatest ally or your worst enemy in the fight against hemorrhoids. So fill your plate with fiber, drink your water, and let your diet be the first step towards a hemorrhoid-free life. Another critical aspect of tackling hemorrhoids lies in our daily habits. More often than not, we overlook the impact our routines have on our overall health, including conditions like hemorrhoids. So, let's dive into how you can modify your lifestyle to alleviate symptoms and prevent hemorrhoids. Regular exercise is one of the most significant changes you can make. It not only promotes general health and well-being, but also plays a crucial role in stimulating bowel movements. You see, when we engage in physical activity, our body's metabolism increases, which in turn aids digestion, and a healthy digestive system is less likely to create conditions that lead to hemorrhoids. So, whether it's a brisk walk around the block, a swim at your local pool, or a yoga session in your living room, getting your body moving is a step in the right direction. Now let's talk about something we all do, sitting. While it's often unavoidable, especially for those of us with desk jobs, prolonged sitting can put unnecessary pressure on the veins in your lower rectum, increasing your risk of hemorrhoids. So, make it a point to stand up and move around every hour or so. This simple change can go a long way in reducing the strain on your lower body. Lastly, it's important to avoid straining during bowel movements. Straining puts extra pressure on the blood vessels in your rectum, increasing your risk of developing hemorrhoids. So, take your time. Remember, it's not a race, and if you're finding it difficult, consider using a stool to elevate your feet. This can make the process easier and less strainful. You see, these aren't drastic lifestyle changes, but small tweaks to your daily routine that can make a world of difference. Each change on its own may seem insignificant, but when combined, they create a powerful defense against hemorrhoids. Making these small but impactful changes in your lifestyle can significantly reduce your hemorrhoid symptoms. Scene script. Sometimes, diet and lifestyle changes may not be enough. That's where over-the-counter treatments come in. Over-the-counter treatments, or OTCs, are readily available options that can offer temporary relief from the discomfort of hemorrhoids. They come in a variety of forms, including creams, ointments, and suppositories, each designed to soothe, shrink, and heal the affected area. Creams and ointments are typically applied externally to the affected area. They work by providing a protective coating over the inflamed tissues, reducing swelling and soothing irritation. Some of these products contain a mild anesthetic to numb the area, helping to ease the pain and discomfort. Suppositories, on the other hand, are designed for internal use. They are inserted into the rectum, where they dissolve and deliver medication directly to the inflamed tissues. These can be particularly helpful for internal hemorrhoids that may be causing discomfort or bleeding. Then, there are pads soaked in witch hazel, a natural anti-inflammatory. These can be applied directly to the hemorrhoids to soothe and shrink them. Witch hazel is known for its astringent properties, which can help to tighten the tissues and reduce swelling. But it's important to remember that while these treatments can provide temporary relief, they don't address the underlying cause of hemorrhoids. They are not a long-term solution, and they don't prevent hemorrhoids from coming back. And as with any treatment, self-medication can have risks. That's why it's always recommended to consult with a healthcare professional before starting any new treatment. They can provide guidance based on your specific condition and help you choose the right treatment option for you. Also, while using these treatments, if you notice any side effects, or if your symptoms persist or worsen, it's crucial to stop using the product and seek medical attention immediately. Over-the-counter treatments can provide temporary relief, but remember, they're not a cure-all. The journey to eliminating hemorrhoids is multifaceted and requires a holistic approach, including diet, lifestyle changes, and in some cases, medical intervention. But with patience, persistence, and professional guidance, you can find relief. In some cases, medical or surgical intervention may be necessary to treat hemorrhoids. When diet modifications, lifestyle changes, and over-the-counter treatments don't provide enough relief, there are several medical and surgical procedures that could be considered. One common procedure is rubber band ligation. This involves a healthcare professional placing a small rubber band around the base of the hemorrhoid. This band cuts off blood flow to the hemorrhoid, causing it to shrink and eventually fall off. While this might sound a bit intimidating, it's actually a pretty quick and simple procedure, typically performed right in the doctor's office. Another option is sclerotherapy. In this procedure, a chemical solution is injected directly into the hemorrhoid or the area around it. This causes the hemorrhoid to shrink and eventually disappear. It's a relatively painless procedure and is often used for smaller hemorrhoids. But what if these procedures aren't enough? That's where a hemorrhoidectomy comes into play. This is a surgical procedure that involves the complete removal of the hemorrhoid. It's typically considered for large or severe hemorrhoids that haven't responded to other treatments. It's performed under anesthesia and usually requires a bit of recovery time. It's important to note that while these procedures can be highly effective, they're not without risks. Potential complications can include pain, bleeding, and infection. That's why it's so crucial to discuss all of your options with a healthcare professional. They can help you weigh the benefits and risks and determine the best course of action for your specific situation. Remember, hemorrhoids are a common condition, and there's no need to feel embarrassed about seeking help. In fact, it's a sign of strength and self-care to reach out to a healthcare professional when you need assistance. So, if you've tried other treatments and are still struggling with hemorrhoids, don't lose hope. Medical and surgical procedures can be highly effective, but they're typically considered as a last resort when other treatments have failed. So we've covered a lot of ground today on the topic of hemorrhoids. It's a common issue that many people encounter, but unfortunately, it's one of those things that isn't frequently discussed. So let's take a moment to recap the important points we've touched on today. Firstly, we unraveled the mystery of hemorrhoids, shedding light on what they are and how they occur. We learned that they're swollen veins in the lowest part of your rectum and anus, and that they're similar to varicose veins. We also discovered that they're quite common, especially as we age. Next, we delved into the first step of eliminating hemorrhoids: diet modifications. We learned that a diet rich in fiber can soften the stool, reduce pressure on the lower rectum, and prevent hemorrhoids from developing. It's as simple as incorporating more fruits, vegetables, and whole grains into our meals. Then, we moved on to lifestyle changes. We emphasized the importance of not ignoring nature's call, as delaying a bowel movement can lead to harder stools and straining. Exercise also plays a key role, as it can help reduce pressure on veins, which is a leading cause of hemorrhoids. Our journey continued with a look at over-the-counter treatments. We learned that there are numerous creams, ointments, and suppositories available that can relieve pain and inflammation. Finally, we explored medical and surgical procedures. We learned that for more severe or persistent cases, there are several effective procedures available, including rubber band ligation, sclerotherapy, and hemorrhoidectomy. But remember, it's crucial to consult with a healthcare professional before embarking on any treatment plan. They can provide advice tailored to your specific situation and needs. Remember, dealing with hemorrhoids can be tough, but you're not alone. There are solutions out there, and it's possible to regain control of your life. Thank you for tuning in. Before we wrap up, we have a small request. If you've found this video helpful and informative, please consider subscribing to our channel. By doing so, You'll not only be supporting our efforts to provide valuable health information, but you'll also be the first to know when we release new videos, updates, and more. We're here to help you navigate your health journey, and your support helps us continue to bring you the latest and most crucial health insights. So, hit that subscribe button and join our community of health-conscious individuals. Remember, your health is your wealth. Stay informed, stay healthy. Thank you for your support.